In this video, you'll be learning about meningitis. Meningitis can turn deadly, so understanding it early will help you recognize it fast. But before we go in and start talking about what meningitis is, what are the meninges? What do they do? Why are they in our body? And what do they do in the body? So let's dive in and see what these meninges are. As we all know, the brain is very delicate, and to that effect, it needs extra protection. That's why we have it up there inside the skull. And inside the skull, it also has three layers of tissues that protect it from cushion. It also protects it from infection. It also protects it from trauma. So these three layers of tissues are referred to as the meninges. And these three layers of tissues are the dura mater, which is the outermost and the toughest layer, and then we have the middle layer, which is the arachnoid matter, and the innermost layer, which is the pia mater. The pia mater is the layer that has direct contact with the brain, and it is the most delicate layer. You see why the brain has to be protected. Right from the skull, it comes down to the meninges, from the meninges before it can now get to the brain. I'll give you an acronym. So from the outermost to the innermost layer, you can use the acronym DAP to know the meninges according to their positions. We have the dura mater, the arachnoid mater, and the pia mater. And we've already established the fact that the dura mater is the outermost layer. Comment epidural if you've watched this video up to this moment. Now, what are the functions of the meninges? The first function here is to protect it from mechanical wear and tear. Remember, we said that the brain is a very delicate organ, so it has to be enclosed in an area whereby even if there is forward and backward movement of the head, it won't really affect the brain. The meninges also have a protective barrier against infections and toxins, so that when all these toxins that are in the body find their way upstairs, it won't affect the brain nor the spinal cord. That is why we have the meninges, and it is very important for you to protect the meninges. Otherwise, the infection will get to the brain. The meninges also cushion the CNS with cerebrospinal fluid. The CNS we are referring to the brain and the spinal cord. So it is the duty of the meninges to cushion them with the cerebrospinal fluid. Now that you've understood the functions of the meninges, let's look at meningitis proper. Meningitis has to do with the inflammation of the meninges due to infection or other non-infective causes. Now remember, each time you hear any organ that ends with itis, it means an inflammation of the organ. So if you hear meningitis, it refers to inflammation of the meninges. If you hear appendicitis, it refers to the inflammation of the appendix. So let me break down the meningitis further. The meningitis causes swelling in the meninges, and when this happens, it limits the room the brain has, and this will lead to increased intracranial pressure. And when intracranial pressure is increased, it leads to decreased blood supply to the brain, and this will further lead to brain damage and brain tissue death. So now let's talk about the types. I'm going to classify it based on the causes. Based on this classification, we have four types of meningitis. The first one is the bacterial meningitis that is caused by bacterial infection, usually the Neisseria species and so on and so forth. And this bacterial meningitis seems to be the most severe form of meningitis. And then we also have the next form, which is the viral meningitis. Although in most cases, the viral meningitis could resolve on its own, unless in cases of immunocompromise, like in patients that have HIV. So when these patients have HIV, there is also a tendency that this this virus would travel up to the brain, or it could also invite other viruses. Like we all know in HIV, it compromises the immune system. So when there's an immunocompromise, the HIV will invite all other microorganisms, other infections, and it will allow them fly into the meninges and cause meningitis. And then we also have the less common form of meningitis, which is the fungal meningitis. And then There's also another type of meningitis which is not infective, and this could be caused as a result of a reaction to a medication or an autoimmune disease or even cancer. So you can see it is not only infections that cause meningitis. Now let's look at the signs and symptoms or the red flags you want to watch out for in meningitis. Now we have the first one, which is the classic triad. The classic triad looks at three symptoms that present at the same time, and these symptoms can be linked to meningitis. And the symptoms include fever, which is a classic symptom of inflammation. You also find headache and neck stiffness, which is also called the nuchal rigidity. If you find these three symptoms, it suggests that the patient could be suffering from meningitis. Other additional findings that you may see in a patient with meningitis include vomiting. You can also see photophobia. You find that this patient is very sensitive to light. In fact, the patient is afraid of light itself, bright light. There could also be seizure and confusion. And then, if the patient is an infant, you find out that there could be bulging fontanelle. You see the fontanelle in the head, it will be bulging. It's also a sign that this patient is having meningitis. Now, having seen all these signs of meningitis, you may not just conclude that this patient is having meningitis until you've carried out some diagnostic evaluations, which I'm going to be listing out for you here. Now, the most definitive test for meningitis is the lumbar puncture. So the lumbar puncture is done to get the cerebrospinal fluid, and when the cerebrospinal fluid is extracted, it can now be taken to the lab for further investigation. And also, when the cerebrospinal fluid is extracted, you may also check out for other signs like cloudiness of the CSF. So if the CSF is cloudy, it suggests that this patient has meningitis. So you may take it to the lab for further investigations. You could also do some blood culture to identify the particular organism that is causing the disease so that you can begin treatment promptly. Comment culture if you want me to do a video about culture, and I'll add it to my schedule. In less than no time, you'll see that video on this channel. And if you've watched this video to this point, do well to like the video, subscribe to this channel, and also share this video with your friends so that they won't miss out on my updates. Now, another investigation you may want to do to confirm the diagnosis of meningitis is the CT scan. The CT scan will help you visualize the meninges and know if there are any inflammations there. Another sign you want to watch out for during your diagnostic evaluation is the Koenig sign. If there is a positive Koenig sign, it means that this patient has meningitis. If you really want to know what the Koenig sign is, drop it in the comment section and I will do another video on Koenig sign and how to assess it. But for now, let's continue with our lesson on meningitis. At this point, we've known what meningitis is, we've known the causes, the signs and symptoms, and how and other laboratory investigations we can run to confirm if a patient has meningitis. Now, let's look at how this meningitis can be managed. In the management plan for meningitis, you have to include IV fluids because this patient is likely to get dehydrated. You also want to include oxygen therapy because the patient will be needing oxygen. Now, remember I said that this patient will be having photophobia. So you want to nurse your patient in a very calm environment. You don't want to you don't want to have too many lights in the room. The environment has to be calm and noise free so that you don't irritate this patient further. You can also administer some corticosteroids like hydrocortisone and prednisolone to slow down the inflammation so that it won't cause more trouble for the patient. Remember, inflammation is a natural process and it is beneficial to the body, but in a situation whereby it takes a long process, it could be detrimental. You may also want to comment inflammation so that I'll do a video on inflammation so you understand it better. And then meningitis could also cause seizures. So if there is seizure in that patient, you want to administer anticonvulsants to bring down the seizure or to control the seizure. And then you may also want to consider antimicrobials depending on the cause of the meningitis. If it is a bacterial meningitis, use antibiotics. If it is viral meningitis, use antiviral medications. And if it is fungal meningitis, you get antifungal for the patient to manage this condition. Alright, for now is a wrap. Do well to like this video, subscribe to this channel, and don't be stingy with this video. Let a friend know about this video. I promise you I'll be dropping back-to-back updates on this channel. See you on the next one.